Yes.
Karthik, so why are people joining and moving out? Is there a problem with the link or something?
No, doctor. No.
But because I can see everyone are joining in and then they are leaving. I don't know if there is a problem with the link. Anyway, let's see. Yeah.
Okay.
Sibi, you can share the screen later. Okay, let's have an introduction and then we can share the screen.
Battery low. Please charge now.
We will start in next 5 minutes. Yeah, 5-10 minutes. We will start in next 2-3 minutes, Sibi. Okay, we will wait for a few more people to join, or else we will start.
Yes.
Yeah. All right, I think we will start. Yeah, good. Okay, so welcome every one of you on behalf of PrepMedico and team Nama Medicine, and we have gathered here to initiate our first webinar among the series of 7 to 8 webinars, which is going to follow this webinar every Sunday, to know about the basics of the pathway into UK, knowing about the PLAB exams, the difficulties and the tricks and tips in passing PLAB exams, and also to know more about what next after clearing PLAB exams in terms of your job opportunities, how to enter your further surgical or medicine training or taking your end specialities, and about the MSRA exams and portfolio building. So that's the whole aim of the series of webinar, which we are planning for the next 8 weeks. So today it is an introductory session where we will be discussing in a very basic way about the PLAB Part 2 exam or the PLAB 2 exams, discussing on what is the exam pattern, what is expected, what are the myths around the exam, how do you prepare for the exam, etc., etc. And then we will, the next speaker following the introduction to PLAB will talk about what after PLAB in terms of your portfolio building, your MSRA exams, etc. So this is the agenda for today, and anytime if you have any doubts, please feel free to put messages in the chat box here, or you can wait until the end of the meeting where you can ask questions, or you can raise your hands now and then when we can stop in between and ask you. So we have done quite a lot of similar meetings before in terms of PLAB, but this meeting is quite different from what we have done before. And again, this is something like a series of webinars where we are trying to address every aspect of the PLAB exam rather than just giving an orientation. So today will be an orientation session, but the subsequent sessions will be something like a test and do session on the each modules within the PLAB 2 exams. So the speakers for today, let me introduce. We have Dr. Sibiraj, Dr. Nishita, Dr. Manikandan, Dr. Harish, Dr. Meena. So let us start with, sorry, someone is, okay. So is it someone texting here? No. Okay, fine. So yeah. So let me start with Sibi. So he will give you a brief introduction, and probably they will start the presentation, and I will be moderating the session. I will stop in between, ask some questions on behalf of the audience, and if there is any questions from the audience, please feel free to raise your hands. Thank you. Over to Sibi.
So good afternoon, guys. This is the first webinar series of PLAB exams. So our first speaker is going to talk to you about introduction and what are the stations you're going to get for PLAB 2. So I'll leave it over to Nishita. So Nishita, you can start.
So hello people, so I am Dr. Nishita. So I've passed my PLAB 2 in September. So today I'm going to discuss basic introduction about PLAB 2, exactly what PLAB 2 is, and I'm going to tell you guys what you guys will gain after this webinar. So I am expecting few things which you should know after this webinar. Those are given here as mentioned, insights into the PLAB 2 exam structure. We'll make sure you know how the exam is going to be, how the stations are going to be, okay? And then we'll tell you how examiners they assess you guys. Suppose there are many things. One person focuses on interpersonal skills, whereas one person is intelligent who has some diagnostic skills, someone is good, someone may be good at treatment part. So we will tell what all is required in this. Okay, so the third point which you guys should know is the strategies, because before giving any exam or going for anything, you should have a strategy in mind, what you are going to focus, where guys are going to gain marks. Suppose someone who is good in examination, so we would like him to focus on that part and other aspects as well. But a person can be at least sure that particular person will gain full marks in the examination section. Okay, then will make sure that we take 1 or 2 role plays where we will make you guys practice, and in future also we will have some one-on-one sessions whenever we are free. We will post some links so that you guys can do practice with us, because I think practicing with us will be very useful for you guys, because we have recently experienced, since I passed in September, the other people also passed in September, October, November. So it will be very helpful to you, because to be honest, PLAB 2 is changing with time. It is evolving. So these days, how people are going to be, how examiners are going to be, you'll have a better idea about that. Okay. And then we are going to tell you about some ethical and legal awareness that is very important, since most of the people are IMGs, that is international medical graduates. Then they're not from UK, so things are a bit different here. Ethically and legally, there are some things which we have to be very careful. We have to be very careful about, which we were not in our home countries. Okay, and then we have some very interesting thing. MSRA exam and basically the training aspects. So how you guys are going to enter into the training? PLAB 1, PLAB 2 is over. Then what? After that, people waste a lot of time because they don't know how to go forward. Because PLAB 2 is something which we talk about a lot, for which we have many webinars, many sessions going on. But what is missing is what to do after PLAB 2. How to get into training, because honestly, everyone's plan for giving PLAB 2 is to do a training in UK, to do a post-graduation in UK, right? So for that also, we have a speaker here with us. Okay, Sibi, can I have the next slide, please? Okay, so these are some topics which we are going to cover: introduction to PLAB 2, and then we are going to discuss station types. Then someone is going to talk about misconceptions, and then we have a scoring domain, how you're going to get scored. Okay, next please. Okay, so what does basically examiner expects from you is also going to be explained here. Then we have some techniques, some things which we guys have also tested and which we have also used during our exam. Then we have is time management, because this is the crucial part. Most of the people know a lot of things, but they don't know how to manage the time. Then we have is the final day, the day, how we are going to manage the anxiety, because mostly people are very good, but on the exam day they get very anxious and they spoil their exams. So these are some things which we are going to discuss, which most of the people don't think are important. Okay, can I have the next slide? Yeah, so now we have this basic introduction to PLAB 2. So what is PLAB 2? Basically, PLAB 2 means practical application of basic clinical skills and assessment. Since most of you guys have already given PLAB 1 and now are planning to give PLAB 2, so your knowledge has already been tested. They know you how much you know, and if you have passed, it means you are at that par level that you can practice in UK on the basis of knowledge. But what UK people want now is to know if you are practically capable to practice there or not. Okay, so this is the exam which is going to judge if we are practically adequately trained or not. Okay, so what people there wants, what JMC wants from us, they don't expect too much knowledge. They don't expect we doing surgeries. They don't expect we doing massive cases, we solving problems, diagnosing diseases. What they want from us is we have to be safe doctors. This is the tagline which you guys should always keep in mind: safe doctor. What people want there is, suppose if there's a case which I'm a junior doctor here and I'm not able to handle. So what they expect from us is we should be confident enough to communicate to our seniors so that they can take over. They can take it the next step over. They don't want a shy doctor, What they want is patient to be safe, because for NHS and for GMC the patient safety is the priority. You know what? In NHS, there's a line known as patient care is important, which has a very deep meaning. That's what they want. They want us to take care of patients, be it mentally, be it physically. We have to be there to understand what the patient wants from us. And even if by any chance the patient is not recovering, what should be our priority is to then also take care of the patient, how he is feeling. Okay. So can I have the next slide, please? Okay. So before that, do you guys have any questions? Please feel free to answer. Feel free to ask. Sorry. Okay. So yeah, so now we'll discuss how PLAB 2 exam is going to be. So in PLAB 2 exams, there are going to be 18 stations, okay, in which there are going to be 2 rest stations and 16 stations where you have to actually perform. So the good thing is you guys are going to have the 2 stations in which you can have very tasty cookies, and then you are going to have 16 stations in which they're going to test your ethical knowledge, they're going to test your practical knowledge, they're going to make you examine the patient, they're going to manage your diagnostic skills. So we have certain things there which they're going to manage. And what I would suggest is you should think of it as a normal busy clinic day, nothing else. And keep one thing in mind, whatever they are asking, you have to answer that. Suppose if they're asking you to examine, suppose there's a case you have to do a ABG test. Okay, there's no need to go for a very mass and massive history. There's no need to go for treatment. Your main focus should be the ABG thing, because that is something which is going to give you marks. And we're going to discuss these things in future, but this is just an idea which I'm planning to give which I was trying to give right now. Then we have a 8-minute session. So each 8 minutes would start with a start bell, where it will be like begin, and then start bell, then 1.5 minutes you'll have the time to read what is given outside, to read what is the case. After reading, then there'll be a bell called begin, where you have to enter the station, and then in entering the station, you'll have 6 minutes, and you can speak whatever you feel like. Then there'll be an alarm for when there are 2 minutes left, saying 2 minutes remaining. That is very crucial, because at that time you should be knowing your time is going to get over, you're going to get scored on that basis. So you have to make sure that by that time you are on the treatment part, or you are in the end of your consultation. Okay. And then there'll be then in the end there's going to be move on to the next station. Okay, once you go out, you go to the next station, and then it repeats. You will hear a start bell. There you are going to read the particular case for 1.5 minutes. And mind you, those 1.5 minutes are very important. You should have in mind what you're going to do, or at least you should have in your mind initial 2 to 3 questions. Okay. Okay, can I have the next slide? Yeah, so then there comes the station types. So the first station is going to, the first type which we have here is, suppose a patient is coming to the hospital. It's a normal thing, like the patient is coming to the hospital, maybe in the emergency section, maybe in the GP clinic. So he is having some disease, he's having some symptoms. You have to diagnose the disease and give the management. Okay. Then we have the second one, in which the patient has already been treated, which we call as a follow-up case. Okay, so patient, suppose there's a patient with the chest pain. He came, he was diagnosed with MA, he was MI, he was treated for MI, but after that he's still having some problems, and or maybe you have only called him for the follow-up. The second case is going to be like that. So how you're going to start first and second case is going to be slightly different. In the first case, you will not know the patient, so you'll ask the patient's name and all. But in the second case, you will know the patient's name. Okay. Now, can I have the third point, please? Yeah. So the third point is dealing with the ethical and the legal issues. So suppose there's a case where you have to tell bad news to someone. Suppose someone is not well, someone is not going to recover, you're hoping. How are you going to deal with those patients? These are the cases which are very crucial, because to be honest, international medical graduates know how to do things, but they don't know what they're lacking is the contact, because in our country we have never been taught how to break a bad news, how to deal with the patient if the patient is angry. the patient is not angry because of our mistakes, or maybe because of something happening, but it is our duty to take care of the patient. Okay, so we have to go with the NHS thing that we have to take care. And suppose if the error is at our side, it will be the case of medical errors or miscellaneous things, suppose there was a case of medical error, the test reports were exchanged with someone else's test reports. How are you going to deal with it? This may happen because NHS is very big and there are lots of people who are participating. There are lots of patient load, so there may be some confusion about that. Okay, so these are the things which we have to deal during the PLAB2 thing. Then we have the fourth point, which means which we are going to have it soon. Sibi, can I have the fourth point, please? I think the slide is not working. It's okay. So the next stations which we are going to have are teaching. Teaching is one of the very important stations. Okay, in teaching stations, we have to tell. Being a doctor has one more important part. It's not just the treating the patient, it is teaching the next generation also, because after you someone else is going to treat the patient. So for that you have to give your teachings as well. So a GMC expects a doctor should be good in teaching. Okay, so the next point we have is there may be times when the colleague may be problematic. Suppose if a colleague is coming late. Okay, so how are we going to deal with that issue? So if a colleague is coming late, so we are going to have a discussion with him. Suppose if a colleague is taking alcohol before the clinic session, we have to have a discussion. So for that case, we have to be very good with our colleagues as well. It doesn't mean we have to take care of just our patients, but also about our colleagues. And for me, it's not just about patients or colleagues. It should be about the equipments also, because NHS does take care of the finances. We have to take care of NHS finances as well. We can't manhandle any machinery. We can't manhandle. Suppose someone is wasting things. Someone is using NHS things without thinking. Suppose NHS things are being used for the personal benefit. So we have to take care of that as well. Okay. Then we are going to have some counseling sessions. In the counseling sessions, suppose if a patient is diabetic and the patient is not ready to control the sugar intake, he is not eating healthy, he is not exercising, we have to explain. We have to be very gentle in that. We have to explain him. And there's one thing which I would like to suggest you can't call a patient overweight in the PLAB2 thing. Just cut this thing overweight out of your thing. You have to explain it in a way you land into the category, which means the reference given to us by the NHS. Suppose it is 20 to 25, you land above 25. You can't use the word overweight, obese. You can't use the words which may not sound good to anyone, which may not make anyone else feel good. Okay. Then next we have is the telephonic conversations. Telephonic conversations are very important, and I feel they are a bit complicated because you don't know the expression, how the patient is feeling after talking to you. You just have to judge by the sound. So this is something which is a bit difficult, but with time, if you are practicing, you will get used to it. So for the telephonic conversations, the few points which I like to say is you have to definitely confirm the address, because you can't break a news or tell anyone about anything during a telephonic conversation without confirming the identity and the name of the patient. Because if you, by any chance, if you are not doing that, in PLAB2 exam, you're going to, that particular session you're going to fail. And even in the future also, if you're breaking a news to someone who's not related, or maybe to a wife also about the husband, then also it may affect you, and they have the right to put a case on you. Okay. Then we have is drug prescriptions. So this is the thing which is very easy according to me. Everything is given to you. In this, you will have a BNF in your station. Okay, so after seeing the BNF, you have to write the prescription, what you're going to do. Okay, suppose there's a prescription of giving a medicine. So for how many days you're going to give, how much dose you're going to give. You don't have to memorize the way we have to. We have to memorize in our home countries. Here we have everything given in the BNF, and according to the BNF, we are going to prescribe the medications. Next we have is a difficult patient, that is a stubborn or the demanding patient. I'll tell you what happened once. Is I was just practicing. There was a practice question. In that practice question, our son was angry because his mother was having some serious disease and he was not informed about particular test. To be honest, when I entered that mock exam, I thought the patient may be concerned about about his mother. But what was it exactly? He was angry because I haven't told him a particular thing, because or the hospital management hasn't told him the particular thing. So you have to be very careful while differentiating if it is angry patient or a breaking bad news. Yeah, it may sound a bit weird to you guys, like if the mother is not recovering and the patient and the son is concerned about you not informing him a particular thing. But this is what it is. For everyone, important things could differ. Okay, and you have to be very accepting about that, and you have to accept each and everything with an open heart. Then next we have is the mannequin, where I mentioned since in India, especially since because I'm from India. In India, we have been taught lots of examinations, how to do catheterization, cannulation, ABG. So this is something like mannequin, where we have to deal with all those things. There we are very good at it. But the point where we lack here is interpersonal skills. Even if you're touching a patient, you have to ask for the permission first. You have to ask for the consent. Then after that, you have to call a person from outside or from anyone who is going to, that we call as a chaperone, for ensuring the patient's safety. Okay, and even if we are going to give a needle prick, we have to tell the prick is coming, the needle is coming. You have to tell anything in needle. Okay, and you have to be very careful in mannequin sessions. That's what I feel. Otherwise, I think most of the people will be able to do it. Or if not, if you guys are joining any academies, definitely attend a particular class that is a mannequin class. You don't need to attend the whole session, but do attend mannequin classes, and hopefully we will also get mannequin soon. Then you can attend our classes also, but definitely you have to practice it once. Then in the end we have is the semen. This is the very interesting thing which you guys are going to have. You guys are going to have a dummy who is acting like a human. Anything you do, he will react. Even if you're not talking to him properly, he will react. So consider him as a real human and be very patient with him. You have to ask each and everything from him before going ahead. Okay, so semen, for semen and prescription, there are limited number of material, there are limited number of stations. If you master those, at least 2 stations you can pass is prescription and semen. Because for semen, I think we have 7 to 10 cases, and for prescription we have 15 to 20 cases. If you mastered that, at least you're passing 2 stations. Okay, so next I think Sibi will take over.
Thank you, Nishita, for the introduction. So just to concise the introduction of what Nishita told. So she gave you an overview about this PLAB 2 exam. Means we are just discussing about PLAB 2. So PLAB 1 exam is just a multiple choice questions which you can take in any part of the world. But PLAB 2 exam till now happens only in the UK, where you need to come to the UK and give the exams. And as Nishita clearly mentioned, this is not an exam which is just to test your knowledge, but it is to test your knowledge, your attitude, your communication skills, your interpersonal behaviors, and also how you respond to a particular situation. Okay, so I always state all the exams in the UK are something like an interview process for choosing you for a particular job for your level. That is how I consider most of these exams. So what is expected from you is how you behave to a particular situation in a very safe manner, not causing harm to the patient. Okay, they are not expecting you to make a high funder diagnosis or manage or treat. What they expect from you is to respond clearly and correctly to a particular situation, communicate it to appropriate people who are above you, about that situation and execute whatever is the plan given by them. That's all they expect. Okay. And moving on to the station types, whatever Nishita told, it's all OSCE stations where you need to go in and perform. Each of these OSCE stations will have examiners who will be observing you. Some stations, the examiners will question you. Some stations, they will just observe you. So it all depends. And Nishita did a good job explaining what are the varieties of stations you will get. And if you again see, all these stations are designed in a way that these are all the scenarios which you as a junior most doctor who will be entering into the NHS will be facing day in and day out. So that's the whole purpose of designing these stations. And it's not just to test your knowledge or give you stress, but whatever you do in this PLAB exam is exactly what you will be doing in the next 1 year until you enter your core surgical training or anything else. So that's the reason why, you know, the people try to take some clinical attachments before PLAB 2 exams, just to get used to the NHS system if you're completely new to the NHS. And if you do some clinical attachment for maybe a month or 3 weeks, you will be seeing all these station varieties and scenarios which comes in the exam in your practice, which you will be observing. Well done, Nishita, for giving you an overview about the various station types. Thank you. Over to Sibi.
So hi guys, I'm going to initially start with some misconceptions people have about the PLAB exam. So the first thing a lot of people have is, so once they book the PLAB exam, they go to the GMC website and see how much percentage of people pass every year, and they think like when you go in a particular day, examiners, you know, tend to fail a particular amount of people every day. So you should know that that is not the case. GMC has a marking system where they have a standard. So if in a particular day, all the candidates fall into the standard, they will pass everyone. And in a particular day, if majority of them do not get into that particular standard, they tend to fail them as well. So don't have this idea that if you are in the bottom 5 or the top 5 or top 16, you will tend to fail or pass. It doesn't work like that. The second one is...
Sorry for interrupting, Sibi. So this is a very important point, you know. Majority of us, you know, who come and give the exams, leave it, whatever exam it is, whether it is an PLAB exam or an MRCS exam or an FRCS exam or MRCP-H or MRCP-CH, we all have the misconception that what if I write in a center in India? What if I write a center in UK? What if I write the exam in Dubai, you know? So all these exams are extremely standardized, tested multiple times, and they have a very standard evaluation process. So whatever exam you write in any part of in any kind of levels you are in the training, in the UK system or the GMC system, so the evaluation pattern is extremely standardized, and you don't need to worry whether you are from India, whether you are brown, you are white, you are giving exams here and there, whether your examiner is an Indian or a Pakistani or a British or a South African, etc. You don't need to bother. Yeah, continues to be.
Yes. So the second point is, so like Dr. Manikandan told, they test you in 3 domains. So your history taking, your interpersonal skills, and your management. So a lot of people who go to academies, who read scripts, and a lot of people come out and, you know, when they discuss with you, they tend to tell you that. So even if you're not able to finish a particular part of the station, but if the patient is happy, examiners tend to score you for all the stations. It's not the case. So examiners expect you to have some amount of knowledge in all these 3 stations. So if it is a history taking and managing station, if you've just taken the history and you've just examined the patient, but you haven't managed the patient adequately, they don't tend to give you any marks for the management. So you should make sure that in a given station, in that particular amount of time, you should complete all the 3 domains in which you're going to be scored for. So that is what I meant by, if the patient is happy, but you haven't completed every part of station, you will still pass. That is actually wrong. So you have to complete all domains, to make sure that examiner scores you in all domains. Now, the third point is, as you all know, PLAB 2 is not an English test. Your English test has been tested prior to PLAB 1, that is your OET or IELTS. So you come in, I'm sure all of you will have some amount of basic English knowledge because you have already completed OET and PLAB 1. So when you explain things to patients in the UK, what they don't want you is the patient to be confused. For example, you should use simple terms when you explain things. So you don't use the word disease, you can use the word condition. You don't give elaborate medical jargons like myocardial infarction. Use simple terms like heart attack, and then you can explain what a heart attack is or what a myocardial infarction is, but keep it all very simple, because at the end of the day, if you're not able to communicate what the condition is to the patient, you might not be able to score as well as the other candidate. So keep it, don't use very elaborate vocabulary, just use simple terms when you explain things to patients in every particular station. Now, the fourth point is you have guidelines for each and every stations. When you are having a psychiatric station, you have a certain guidelines of when you refer the patient, and when you don't refer the patient, what constitutes an emergency in a certain station, what doesn't constitute an emergency, what type of station it is. So what everyone tends to do is, again, they have these notes provided by academies or whatever. So they tend to cram all this and they just go and spit it out in a station. It doesn't work like that. So you might be reading a station in that 1.5 minutes, and you might think this is a station I read in that particular script, so this is how it's going to be. It will not be absolutely like that. So to give an idea, so there may be cases where you have a particular symptom for the patient, but you would have exhausted all your DDs and you might not come up with a diagnosis. So don't be very ardently stricken to all these notes. So be very open, be very logical when you approach a station. Use the guidelines when and wherever necessary. Don't stick to a particular script and perform it like that. People who actually go exactly according to the script, examiners will pick them very easily and they tend to fail them. Now again, like I said, PLAB 2 is solely about knowledge. That is again a misconception. PLAB 2 is your clinical skills as well, but it's more about how you communicate, how safe the patient feels at the end of every station. Now coming to how they score you, in PLAB 2 exam. So the main three domains they look at scoring is, the first domain is your data gathering, your technical and assessment skills. Technical and assessment skill is, are you able to elicit signs and symptoms, and are you able to perform a particular examination properly? The second is your clinical management skills. How are you going to manage that particular symptom or condition? And third is your interpersonal skills. And all these are scored 4 each. Now, coming to interpersonal skills per se, interpersonal skills is scored very subjectively by every examiner. So do not be worried that you might be scored for IPS in like less than any other candidate, because they are going to score, if an examiner feels everyone has an like low level of interpersonal skills, they're going to score everyone like that. So don't be so worried about how they're going to score you. Just go greet the patient, smile, make sure the patient feels comfortable, and just perform the station and come out. Now when you finish your PLAB 2 and after 4 weeks you get your exam, so you're going to get scoring based on these 10 things based on which they score. So the first one is consultation. So the consultation is basically when you approach a patient after reading the scenario for 1.5 minutes, do you have a structured consultation? Do you have an orderly approach of taking questions, taking history, then going into examining the patient properly, and then managing? So what they expect is a very, very structured case taking, or very, very structured consultation with the patient. So if you have a very haphazard consultation, or if you are questioning the patient, then you're jumping to systemic examination, then you're coming back to some more questioning. So they don't expect it to be like that. So you should be very structured when you do it. So then some of you may ask, you ask questions and then you examine the patient, and then you feel somehow that I could have asked some more questions which I left. That is still okay. You go back and ask the patients that I'm sorry, I have missed some questions. Can I ask these questions before I explain to you what this could be? So even if you feel that you missed something, you can politely ask the patient that, can I go back and complete it and then come back? Then that is still okay. But don't have a very messy structure when you go and approach every station. Now, second thing is diagnosis. So as a junior doctor, they don't ask you to come with an exact diagnosis. So if you feel that you're not sure about a diagnosis, you can give them 2-3 differential diagnoses and tell that this could be any of this, and I'm not sure about it, but I will consult with my seniors before I give you a definitive diagnosis. So that is again coming to how safe you are as a junior doctor. Now, third is examination. Now, examination is very important. Again, how do you examine each cases? So when you examine a particular patient, you might jump, like for example, if it is a case of neurology, what a lot of people tend to do is they straight away jump to neurological examination. They don't do a general examination, or they will be in an anxious state to complete it in time. They might ignore whatever is there around. So there might be some instruments which should be used for that examination. So be very aware of your surroundings. Go very stepwise. Finish your general examination, then finish your systemic examination. If you have some instruments which are to be used during that examination, please do use it properly. And ask permission whenever you touch a patient, when you use an instrument on them, and make sure they're comfortable during the examination. And now, findings. So in a particular station, when you have asked a number of questions and you've come up with a diagnosis, you have to identify the right findings. And usually, in most of the cases, in most of the scenarios, patients tend to give you verbal and non-verbal cues to find all these. So try to pick them up, try to come with the right findings so that you give them a definitive diagnosis and a differential diagnosis and issues. So this is another important thing. What happens is, when you do a lot of rote memorization of all these stations, let's say you have a patient who is coming in for an emergency, and because you've memorized in a certain way, in the management part, you have to say these things. So when it's an emergency patient, you're going to address the emergency, how to treat the emergency. Now, if you go in for that patient and start explaining about lifestyle modifications, that is a wrong thing to do. So you have to understand where you are, what scenario you are in, where is the setting, you're in A&E or in a GP clinic, and you have to understand the issues that way, and you have to address it that way. So don't bring in something which is unnecessary for that station just because you've learned it in a script or you've just memorized it. Now, language. This is another part where a lot of IMGs, lack. I wouldn't say lack, but we could do better. So use relevant explanations, especially again. Do use relevant language. Don't use medical jargons, and whenever you're explaining a condition or procedure, make sure we use this term called chunk and check. Explain something to the patient, ask them if they understand it. If they don't understand it, come back to it, explain it better, and always keep doing it when you are in a station. Ask them if they understand it, then move on to the next one. Then, don't use medical jargon, don't explain too quickly, don't explain for 2 minutes and then go and ask patient, did you understand it? Patient might have understand bits and pieces, then you would have to explain it again, wasting another 2 minutes of your time for that station. And listening. So whenever you explain something and patient have some concerns, address it before you perform the station, before you complete performing the station. If you ignore patients, questions, that will again reduce your IPS scoring. And again, if the patient is not happy at the end of the station, there's a good chance that you might fail the station. So be sure you adequately listen to the patient, especially in counseling stations where the patient has a lot of queries. Keep asking the patient if they understood whatever you've told, and do they have any queries, and keep addressing them one by one till the end of the station. Management. Again, coming to management, they again want you to be a safe and competent doctor. They don't expect you to come with a diagnosis, although if you have a diagnosis, go ahead with it. But even if you don't have one, explain the differentials, explain how would you treat each of that part separately, and make sure that if you don't know something, you will consult your senior in a particular station, and try to complete the management in the last 2 minutes if you haven't reached there. So when the last 2-minute bell rings, make sure you've reached management so that you can complete it. Rapport. So make sure you develop a good rapport with the patient in IPS. Start with how good it's of them to come to the clinic today, and how sorry you are that they're going through something like this. Ask them how they're doing back at home. Do they have any social issues? So make sure the patient is comfortable, talking to you and conversing with you. And at the end of the station, patient feels comfortable, when you leave the station, because at the end of every station, the patient is going to discuss how comfortable they were with the examiner, and that is how you get scored for your IPS. Next is time management, and this is the most crucial thing. A lot of people tend to not be able to manage time, particularly within the 8 minutes. So what they do is they ask a lot of questions for differentials, which waste a lot of time, and they, by the time the 2-minute bell rings, they're still in examination. So don't do that. Ask 3 or 4 differentials. If you feel that you're not able to get a diagnosis, it's fine. Go into the examination, come with a management plan, tell them what is the diagnosis or what are the differential diagnosis, and try to complete the station as much as you can. So yeah, this is pretty much what I want to say. Yes. Moving on to the next person.
Thank you, Sibi. So that gives an overall idea about how each session is evaluated. So again, every station you go, so each station will have a difference in the importance which is given to various aspects of your skill which is assessed. And each station, the marks are given for a particular component of your presence in the station, starting from language, your listening, rapport, time management, etc. But Sibi did a good job in giving an overview about what all is considered before they give you a mark in a particular station. Thank you, Sibi. Moving on to the next speaker.
Okay. Hi, friends. My name is Manikandan. I'm a GMC registered doctor currently in London doing a clinical attachment. Okay. I think, Sibi, we have covered all these things. Can we move to the learning method slides, please? Yeah. Okay. Yeah. Yeah. Here. Perfect. Thank you. So, friends, when it comes to PLAB 2 preparations, the first question which everybody has in mind is, which academy should I join? Do I necessarily join an academy? So, the answer to this is it doesn't matter actually. There are people who have passed the exam without joining an academy just by doing clinical attachments and practicing online like that. And there are also people who didn't pass the exam despite joining 2 3 multiple academies as well. So it doesn't matter actually. It all depends upon how we prepare for the exam and how we learn things. Yeah, right. So having said that, how should we prepare? So we should practice in the right way. Just practicing repeatedly 100 times, 200 times in a wrong way, it doesn't make any sense, and it can lead to worsening as well. So we have to make sure that we learn the right method of practicing and practice in a right way, which we will be dealing in the next subsequent slides. And the third important thing is that you make a schedule. We should make a smart schedule, meaning that I think most of you would have come across this acronym. It stands for S for specific, measurable, achievable, realistic, and time-bound schedule. It's not about, a lot of people, including myself, we make schedules with a lot of enthusiasm and passion, and in a day or two, we don't follow them rigorously. So we have to make sure that it is actually an achievable and a followable schedule, and we have to stick on to the schedule. Yes, next slide, please. Yeah, so what do we need in this exam? 3 things, not only in PLAB 2, but any aspect of any UK-based exam. All keys, we are tested on knowledge, skills, and values. We'll see them one by one. Knowledge. When it comes to knowledge, as we all know, the knowledge part is already tested on PLAB 1, where we answered all the MCQs question in the 3-hour format. However, for PLAB 2 also we need some knowledge, obviously, and so it is a good idea to revisit the GMC blueprint for PLAB because it applies for PLAB 2 as well. A lot of people don't care about this blueprint, but trust me, it actually matters a lot. If you see the stations, people had for the exams, all the stations which they had were actually in the blueprint when we see retrospectively. So please spend your time. I have posted the link in the screen. You can take a screenshot and you can visit the link, and please download the GMC blueprint for PLAB and make sure that you are familiar with all the conditions present in the blueprint. And the third important thing is that we have to know something about everything. It makes no sense for this exam, to dive deep into Harrison or Davidson to read about all aspects of a particular topic. It doesn't work like that way. Rather, our spectrum of knowledge should be wide so that we are covering a lot of conditions while knowing something about all of them. Next slide, please. Okay, what should I know? What should we know? So we have to know, the first thing is the common presenting complaints of conditions, how they present. For example, renal stones present with low and abdominal pain. So like that, we have to know how the conditions present. And as previous speakers mentioned, we should not use the term disease, because the word disease is attributed to a lot of negativity here. So patients may feel bad if we tell that you are having a certain disease. Rather, please use the word condition. Mr. X, I'm afraid that you have a condition called diabetes. Mr. Y, I want to tell you that you might be having a condition called hypertension. So condition, the word condition is important. Make sure you integrate into your practice. If you are right now working as a doctor, please integrate that into your practice. Use the word condition, not disease, please. And basic investigations, for common conditions, what all the investigations we do, we should know about the basic investigations which we do. And about the basic treatment, again, we need not dive deep into the treatment. When it comes to treatment, make sure you divide your knowledge into 4 parts. What your patient can do. Let's take an example of hypertension. Okay, so let's take an example that a patient's blood pressure is 180/100, which is drastically above the normal limit, and we are treating the patient now. The first thing we have to tell is lifestyle modifications, what the patient can do, because it holds a lot of importance in the exam as well as in the practice. You need not be penalized if you forgot the name of one drug, but you will definitely be penalized if you forget to tell the patient about the dietary modifications like salt restriction and other things. And second thing is that what you can offer, say for example medications which we can offer. And third thing is that if in case we are referring the patient to the specialist, you have to give a glimpse of what the specialist might be doing. And the fourth important thing is very important. We have to do safety netting. For example, if the patient has hypertension, you have to, if you are discharging the patient to home, if you're sending the patient on an OPD basis, you have to tell the patient that in case you develop blurring of vision, in case you develop severe headache, or in case you develop any other signs of adversity, please rush to the nearest accidents and emergency as soon as possible. This is a bit of safety netting which you can individually cater for each condition, and you can integrate into your practice as well. Next slide, please. Okay, where do I find all this information? Where should I refer? So, guys, I would highly recommend you to take a screenshot of this slide because it can be definitely useful for you. So the first thing is NHS Health A to Z. Trust me, it is a very, very, very lovely site, and you can find all the information which are necessary for the exam. Literally, it is written based on a UK perspective. So this is what we actually practice in our day-to-day life. So you can use that website as a source of reference for any condition. Number two is NICE guidelines. You can refer if you have certain doubts, and if you want to know more about a condition, you can refer NICE guidelines. Number three, there is a website called Geeky Medics. It is actually free. It also has a paid subscription, but you need not take that one. If you want, you can take, but there are adequate sources available free of cost, which can be of great use in this exam. There are stations. There are also people you can practice with, the medical students of the United Kingdom, which can be of great advantage to you. If you do that, you can be familiar with the accent and things, and I'll tell more about in the coming slides. And QuestMed is also a similar website to Geeky Medics, and both of them have separate YouTube channels. You can visit them and you can watch the OSCE stations of those channels. And the last 3 points are very interesting because a lot of people don't use these sources, but trust me, they are very, very helpful. There is a series called GPs Behind Closed Doors. It is actually a documentary like series. What happens is patients coming to the GPs, they have placed cameras inside the GPs, which are after getting consent, and you will be witnessing real patient GP interactions in those videos, in those series episodes. So it will be like doing clinical attachment in a virtual mode, where you will be actually seeing patients interacting with doctors. So it is very useful, and you can get used to the accent, you can get used to the cultural things, and you will see crying patients, and you will see social issues. Everything is there in the series. So make sure you watch one episode of 15 minutes every day so that it gets integrated into your practice. And 24 Hours in A&E also is a similar series, which is based on an A&E setting. So it will. The previous thing was the GP based one. This is an accidents and emergency based one. It is also very useful if you watch. And number 3 is YouTube patient stories. Say for example, cystic fibrosis. If you type cystic fibrosis patient stories, you will see a lot of patients talking about cystic fibrosis who actually had the condition. So if you watch a video of a condition, you will know how it feels to have that condition. So if you know how it feels to have that condition, if the similar station comes in the exam, you will be in a better way to deliver more. You will definitely stand out from the crowd. Yeah. So it is important to stand out from the crowd in PLAB 2 because it's how it works. You have to be different in the exam. You can't be one among the crowd and expect everything to happen in a smooth way. We have to be different. So these 3 things, last 3 things, not everybody does that. So please make the most of it. Next slide, please. Okay, skills. So we finished knowledge. We are coming now to skills. So what are the skills we need? We need clinical skills, physical examination skills, procedural skills, and interpersonal skills. Clinical skills. What do they mean? So we all have completed our MBBS. So we should be comfortable with the examination. And if we are not, please work on that, and please try to learn, try to master common examination skills. And procedural skills are simple, like taking blood samples and catheterization and arterial blood gas sampling. So these are the skills which are tested on the exam, and you can you can improve your skills. And also you have to do them in a sterile way in the exam. It's not like how we do back in our practice. So these are quite different when it comes to the exam. So I would highly recommend again to watch YouTube videos on them on UK based channels, which we will see on the subsequent slides. Number 3, interpersonal skills. It's about how we talk to each other and how we maintain good relationship with the colleagues and with the patients. uh, how do we improve interpersonal skills? Yeah, thanks for changing. And yeah, so coming back, I told about the procedural skills. I learned the correct methods by watching YouTube videos of NHS trusts and UK medical schools. You can just type keywords like venipuncture, blood sampling, NHS. You will see a lot of videos coming up, and you can watch one of them. And there are models of communication like SBAR, situation, background, assessment, and recommendation. There are certain models of communication which are routinely used in the NHS. Again, these are available on YouTube. YouTube is a free and beautiful resource. Please make the most of it. And how to improve skills? Number 2 is practice repeatedly. Again, practice in the right way. Find a study partner and practice with them. Or if you don't have a study partner and if you're working, practice interpersonal skills in your workplace. It doesn't need to be in English necessarily. Whatever your home language is, the skills doesn't change, only the language changes. So practice the skills. When the next time when you talk to the patient, talk with more compassion and talk with more empathy. And next time when you talk with the colleague, do the same, please. And number 3, practice talking slowly and clearly. This is some advice which is applicable to everybody, including me. A lot of us, it is not a wrong thing, because in our language, the space of words is we have been trained in a way to speak fast throughout our life. So it is very difficult to change the speed of our voice all of a sudden. So I would recommend to start working on that from now. Even if your exam is 6 months away, 8 months away, doesn't matter. In the exam, it is very important that you talk slowly and clearly, because our accent is different from the British accent. So people will find it a lot difficult to understand us if we talk fastly. We can understand. If you speak fastly, I can understand. If I speak fastly, you can understand. But for a native speaker, if we speak fastly, they can't understand. Simply they will ask, what, could you please repeat that? And there are 2 negative things which happen if they ask you to repeat. Number 1, it is a negative thing that they didn't understand you. Number 2, you're wasting 15 seconds of your 8 minutes, which is very costly. We can't afford that, guys. So please practice talking slowly and clearly. Next slide, please. Right, so we have finished knowledge and skills. We are coming now to values. Values are the most important thing among the 3. That's how it is different from our country. So these 4 things which you see on the screen are the 4 pillars of medical ethics: autonomy, beneficence, non-maleficence, and justice. And if you had read for PLAB 1 in a very religious way, you definitely would have come across these 4 principles. Again, these 4 things are tested on PLAB 2. Autonomy is something you give respect to the patient, and the patient has the right for their treatment and right for their governance. You have to respect the patient's wishes. Say, for example, if the patient has cancer but they are not willing for treatment, we have to respect that wish. Though it is not a wise decision to make from your perspective, it is important that we respect those wishes. So these are the principles which the GMC tests on us, because they know that we are knowledgeable, because the Indian medical system and other medical systems as well are far more proficient. So we all have adequate knowledge and skills, but it is the values which we often lack sometimes when it compared to the UK standards, and so they are more interested in testing on the values. Number two is beneficence. The name implies that you do good for the patient. Number three is non-maleficence, do no harm. Say, for example, if you don't know the treatment for a particular condition, tell that you don't know and be frankly, openly accept that and tell that you will escalate to your seniors rather than covering up with something else. Number four is justice. This is an interesting thing. Justice and non-judgmental attitude. We have to provide fair treatment for everybody. If a drug addict comes to you, and also there is a lot of rise in the LGBT things going on, so there will definitely be a station on your exam on the LGBT issues. You might have a different opinion on LGBT, but in the exam and also while practicing in the UK, we have to have a non-judgmental and a fair attitude even while treating LGBT patients, and you should not show any difference to them. That is very important, and the GMC is very keen on testing that perspective from international medical graduates, because a lot of people from India and other countries, they will have a different opinion on LGBT. So these stations will definitely, there are high chances that you will get the station on the exam. So please make sure that you get yourself used to these things which are going on. Next slide, please. Yeah, stations where values are on focus. So these four stations, are the stations where your medical knowledge is not at all tested or tested to a very minimal extent. Breaking bad news, it's about how you break the bad news to the patient or their family member. It has literally nothing to do with your medical knowledge. It's all about your skills, and it's all about how compassionately you deliver the news and how you're making the patient comfortable. Number two is medical errors. You or your colleague might have committed some medical errors, say, for example, missing a diagnosis or missing the blood samples or something like that. And we'll be having a station where we have to explain the patient about what happened and apologize. Number three, angry patient. This is a subtype of medical errors, but it can also be without medical errors. Say, for example, a patient waiting for a long time, or um, a similar a demanding patient who needs antibiotics for a non-infective cause. You'll be having stations like these where you have to manage angry patients. Number four, colleague confrontations. So this is a totally different kind of scenario, again, where there is no testing on medical knowledge. It is about, I'll give you an example, where we'll be having colleagues with, sometimes with a smell of alcohol, or with using some white colored powder. I'm sure these questions would also have been in PLAB 1. So similar questions will also be there in PLAB 2, where you'll be tested on your values. Next slide, please. Okay, we are coming to the end of preparation techniques. How should I learn? So the open secret is there is literally no right or wrong way. These are very subjective things, and so whichever technique feels comfortable for you, go with that, and make sure you practice in the right way. And make a system-wise schedule. Again, as I told in the beginning, make a smart schedule which is actually realistically achievable, and stick on to that. And number three is very important, asynchronous practice. What do I mean by asynchronous practice? As we discussed previously, we have different types of stations. So you take up one clinical topic, say, for example, in any subject, say cardiology or respiratory system, doesn't matter, but one clinical topic, but plus one ethical topic, which we discussed previously, plus one prescription station. As the speaker Nishita told in the initial slides, prescription writing is a very easy station where we can score more marks. So make sure that you practice prescription every day, and also Simmons and mannequins. So make sure that you do all these stations practice every day so that you get comfortable on the day of your exam. Number four, verbalize and practice. Verbalize in the sense, what do I mean by verbalize? So say, for example, if you are doing urinary catheterization station, when you will be inserting the catheter, you have to verbalize that I'm inserting now. Though there will be no patient there, you will be doing it on a mannequin. You will have to verbalize that, Mr. X, I'm now going to insert the catheter. It may be feeling a bit of this uncomfortable, please bear with me. So like that, we have to verbalize everything you do and practice like that. Next slide, please. Yeah, about study partners, PLAB 2 is all about practicing. It's not just about reading in front of books. So you have to practice with different people with different accents if possible and with different mindsets. Please stay out of your comfort zone. If you practice with a single person, you will get used to them and they will get used to you, and you all be in a comfortable zone where there is no growth at all. So try practice with different people so that you know about different perspectives and try to complete all the topics and provide effective feedback. It is not that you learn only when you perform a station, you also learn a lot when you are actively listening as a patient. So when you are practicing, one of you will be playing a patient role, and one of you will be playing an examiner role, and one of you will be playing the candidate role. So if even if you are playing the patient role, you can learn a lot from your colleague who is practicing with you. So make a note of their mistakes and learn from them as well. And number 4, record your practice sessions and reflect. This is a very important thing. Make sure that you turn on your phone recording app, and record your own voice and record how you practice and record the speed of your words. Can you really understand what you are talking? Just reflect on that and try to make your language clearer every day by listening to them. Next slide, please. And where do I find study partners? If you are somebody who don't have study partners, you don't have friends who are writing exam with you, you can search on Facebook. There are a lot of groups on Facebook where you can find people appearing for PLAB 2, and also in Telegram. And there are a lot of groups. You can join our Telegram group also, where we have a group of people appearing for PLAB 2. And number 3, not everybody knows this. There is an app called Discard, and in the earlier slides, I told you about the Geeky Medics and QuestMed. If you sign up on their websites and if you register, it is free of cost again. If you register in Geeky Medics, you can access the Geeky Medics study group via the Discord. So what is unique about this group is you will have the opportunity to interact with UK medical students, because in the UK, every year has OSCE exams. For example, during the 4th year and 5th year medical students, they'll be having their OSCE exams. So they will be preparing for their OSCE exams, and they will be looking for study partners. So you can sign up on this group and you can introduce yourself that I'm so and so, I'm preparing for PLAB 2, which is an OSCE exam again. And there will be people who will be interested to practice with you as well, because I practiced personally with 4 or 5 people from the UK who were medical students, and it helped a lot for me during the exam to understand the British accent and things like that. Next slide, please. Yes, friends, we have come to the end of the slides for preparation techniques, and please take a screenshot of this. And the second link which I have posted here, please make sure that you visit this link. This is actually an interactive module that GMC has launched recently. If you are somebody who was struggling with medical ethics during your PLAB 1, and this can be of lot of use to you. So because PLAB 2, you will have a lot of ethical stations, and this is actually real life scenarios where you are tested on medical ethics, and there will be explanatory guidance as well. Next slide, please. And again, so this is the NSS website, which I mentioned in the beginning, and this is the Geeky Medics website, which we talked about a while ago. Yeah, I think that's all. Thank you,
Manikandan, for this wonderful talk. So the most important thing about all these UK exams, when immigrants, when I say immigrants, the people who are not from the UK, when they give the exams, you need to first of all understand the fact that these exams are completely different from what you are used to in your home country, wherever you come from, whichever place it is. I mean, some of these systems are more tuned towards a clinical scenario-based approach. Many exam systems are still focused on knowledge-based approach, etc. So before you embark on any exams, okay, wherever you write, whether it's USMLE or an Australian exam or a Singapore exam, first of all, the key is for you to understand what is this exam all about, what they are trying to test, okay? And like Manikandan told, now that if you are eligible to sit PLAB 2 exam, it means that you already have the knowledge to reach there. So your knowledge component is fulfilled before even you reach the PLAB 2 exam. But the reason why a lot of candidates still fail is because they don't understand the exam, they don't know how to prepare for the exam. And as Manigandan told, the simple word is you need to do a smart work. I mean, everyone does hard work. Okay, so hard work, you sit and prepare 10 hours a day, and then you will fail and you'll cry and tell that, oh, you worked very hard, but you didn't. But that's not the key here. So as long as you understand what is expected and what to prepare and how to prepare, and then you do a very smart work, that is what is going to give you success rather than anything else. And all these links means majority of things, which is quite common, but I appreciate Manikandan for sharing the few things which we are not generally used to, and we will try to share all these links in the Telegram group. And as he mentioned, looking for the study partners and stuff, there are plenty of Facebook groups, Telegram groups, but it is very, very essential and crucial that you have 3 or 4 study partners from different areas. When I say different areas, means study partners who are strong in different domains. There might be someone who will be very strong in communication, someone who will be very strong in knowledge, someone who will be very strong in the confidence or attitude with which they speak. So you need to have 5 to 6 study partners rather than 1 study partner, and you discuss with different people. And the time when you learn more is when you ask questions. So when you ask questions to the candidate, that is the time when you learn more. So it should always be rather than just practicing with people who have passed or who are medical students who are just going to question you and you're going to answer. So you need to have partners who are going to give exams, and you need to mutually question each other and learn from each other. That's the most important thing. Okay, and as we go from now on for the next 7 to 8 weeks, we have various domains of this exam or substations of this exam which we will be concentrating upon. So where you will come in the exam, the speakers will give a brief introduction about the station, and you can participate and then get the feedback and get to know what is this station all about and how to answer and what is expected. Okay, good. Thank you, Mani. And then let's move on to Harish, who's going to give a short talk on time management.
Hello, everyone. I hope you can hear to me. Is it right?
Yeah, we can.
Okay, cool. Okay, my name is Harish. I recently cleared my PLAB in August. I'm presently having attachment in Swansea, Wales. Okay, now we are come for the last topic, that is time management and exam fears. Okay, let's start with time management. Okay, how do you manage time in the exam? No, we all are actually we prepare very good. We'll be practiced a lot, but what happens is in the exam? How are you going to put it in a correct way? So I divided here the history taking stations 3 plus 2 plus 3, which means you start with history taking. How much time you're going to give for the history taking? How much time you're going to spend here? That will be around 3 minutes. Let's think 3 minutes. Ask all the questions within these 3 minutes, and next comes with the 2 minutes part. Here comes the IPS, try to ask about patient concerns here. After taking history, comes here and they ask about patient's concerns, any other concerns, and you can also include your examination part. So once you finish these 2 things in 2 minutes, then you can go for management. And how do you actually ask all these questions within the short interval of time you have? Okay, let's think we have 8 minutes of time. How are you going to manage this time? So to be good with that time, what you have to do is you have to be confident first, and well introduce yourself. Try to build the rapport with the patient. When you build the rapport, I'm telling you, you're going to get the answer from the patient. If you're good at speaking to them, then they definitely reply to you in a correct way, in a good way. You get the answers fast, better answers. So try to build the rapport first. And one more thing is be having the presence of mind in these situations. Like, you have to be present there. What happens is you'll be so tensed about the exam. Your brain will be like rushing. Okay, I need to finish this and to ask all the questions. Yeah, I need to, you'll be very much eager to ask all the questions, but you have to little calm down and have the presence of mind. Ask the patient, okay, what is their concern? So when you are asking these questions to them, they'll reply to you, and you'll be able to assess what they're saying to you. If you are in a hurry, definitely won't be knowing what the patient is saying to you. Maybe you told yes, abdominal pain, you may think it has some other pain. So having presence of mind is very important while asking questions to the patient. So once you get these answers, it actually manages your time, to be honest. Okay. Next, what you are going to do is, uh, I already told you, like, having a presence of mind. Before entering the station, you'll be having 1.5 minute time to see the case. Know what case you're going to have now. So there you'll have 1.5 minute time. So what I want you people to do is just, you candidates to do is, see what case it is. You'll definitely have one knowledge about it. Definitely there'll be symptoms they're given to you, or what kind of station I'm going to attend now. So in your mind you can actually, okay, you can have a guess. Okay, this station is going to be this station is going to be counseling station or history taking station. Okay, what all questions will be important in this? There are a lot of questions to ask. PMFTOSA, there's a lot of questions to ask, to be honest, like many questions. So how are you going to ask all the questions? So you can, this scenario, what a station you have. So once you do this, you'll be able to make your time, utilize your time very good, actually. Okay, so once you okay, that's how you can manage your time, by knowing the case, preparing yourself to ask certain questions before entering the station. So you'll have, okay, certain questions that are very important for this station. So in this way, you'll be able to save your time, and you'll also be able to ask very important questions to the patient. Okay, this is history taking. Let's come to the counseling station. For any station, what you have to do is first, building a rapport and taking patient history, knowing what's happening with the patient from patient words. Ask them, actually, build a rapport. Ask them, okay, what made you visit us today? Ask the previous history, what actually made them come today. Like if it is colleague station, ask about, okay, what you are doing, how is your life, any problems. You ask these questions to the colleagues. Or if it's angry patient, you have to be yourself calm and reply to them. And so they'll explain you, okay, what happened. Even though the patient is angry, try to address his questions, but still try to gather some information, take some history. In this way, it actually calms them down, and you'll also have a knowledge about, okay, what case I'm going to do, and what's wrong with the patient. Okay, how I can manage this patient, what I can say to him. So you practice more, you'll get used to it. No, don't worry about that. But what next is, when you practice more, you'll have more knowledge. You'll be like, sometimes you may be biased. I mean, like, you'll be knowing, okay, this case is going to be this. So you'll be in a very much hurry. Okay, you'll be asking questions related to that. So don't ever do that. Try to be like, just take it, be open-minded. Go ask questions. According to symptoms, you can decide the diagnosis. Don't ever consider, okay, this patient has symptom, okay, this could be this. No, don't be that. Just go, ask the symptom. Definitely you'll get the answer. The patient is there to give the information. So never think that the patient is hiding something. No, you take your history properly. Definitely they're going to answer to your questions. All the questions they'll answer to you. But only thing is, maintain your calm, ask in a good way. I mean, so that they'll answer to you. Okay, let's go to drug prescription. I know most of us, you think like, okay, drug prescriptions is very easy, we can finish it off. No, it actually takes more time. Sometimes you be knowing the drugs actually, and you may be knowing the doses, but sometimes you may forget it. So what you're going to do is, what are the important drugs there are? Okay, these are the important drugs. So choose that drug first. If at all you forgot the dosage, check the dosage for the important drug, which is very much life-saving drugs. So when you write these drugs in the prescription sheet, what they're given to you, you have the more chances that you'll pass the exam. So select priorities like this. And opening BNF is very important in the exam. Don't think you know I mean, like prescription, I know the dosage, I can write it. No, you have to cross check. You have to be a safe doctor. So opening BNF and checking is very important. Okay. Can you go for next slide, please? Okay. Now comes the last day of exam. Okay, the time has come. You are going to give exam now. Here comes the most important thing. Have a good sleep the day before the exam. Make yourself calm and practicing before exam. Definitely 1 or 2 days before the exam, everyone will be very much panicked. Okay, I don't know, I'm not doing well. I was doing better, I'm not doing well. There'll be so many things coming in your mind. But what I suggested is it okay? It is normal to be like that. Just think, okay, definitely I'm going to do well. Be confident. Okay, if possible, in the morning before you going to exam, just practice one station just to get hang on it. Like, I mean, if you practice, you don't be a first case when you enter the exam. So just try to practice one station at least, like one scenario, some scenario, which is very easy with your friend or someone before going to exam. It varies to person, but that's what I suggest. But it helps in many ways actually. Okay, once you go there, make sure that you're reaching the exam center like at least 1-2 hours early. So they take you in, and there'll be 1.5 hour time before exam starts. You have to sit in a place where they send you actually. So there's a place where you get tense most. So try to be calm in this time, because if you are most tensed, there's a chance that you may not do well in the exam. I hope you get it. So once you start your station, so when you'll get 1.5 time. I told you that you get 1.5 time, 1.5 minute. So in that minute, try to process the information. Okay, what I'm going to ask to the patient. So once you have knowledge of this, definitely the station is not going to be hard. You're definitely going to be calm. So once you enter inside, smiling is the most important thing. Smile actually. We all will be tense more, we won't often smile. When you smiling is very important thing. Please remember this, and greet to them, to the examiner and to the patient. Okay, good morning, yeah. Tell your GMC number, then you start your thing. Some people even forget to introduce themselves, and they won't even tell the GMC, and they suddenly take the sheet, and see, that's the difference you make. Be calm. Just try to try to think you're a doctor. Don't think you're a student. When you have this mentality, definitely you're going to pass exam. I can make sure, because when you are think you are a candidate, you feel it is an exam, but it's not. If you think you as a doctor, okay, if you are a doctor and the patient is sitting in front of you, what questions you really ask to make the diagnosis? If you do this, definitely it's going to help you. And about doing clinical attachment, some people do clinical attachment after the PLAB too, but it's better to do clinical attachment before. There's so many clinical attachments available. Something called clinical attachment program, where they actually train you. They'll give you scenarios. It's like a training program. They'll give you some questions, like they practice with you. So doing clinical attachment is one more thing. You'll be more confident, and while practicing with friends, you'll have lots of doubt, and you're not sure whether what your friend is saying correct or not. In that case, it's always better to ask who's already working in NHS. They'll give you a good knowledge. They'll give you good information about what are the doubts you have. Since all of us here, I already had an attachment, and many of us are going to work, so you can ask these doubts to us. Definitely, will be very much happy to help you guys. Okay. Okay, I'd like to go to the next slide, please. Okay. One more exam is MSRA. That is multi-specialty recruitment assessment. About this exam, my colleague Meena is going to explain you in detail. I'll just give an introduction. What is it actually? It's an exam which is done for recruiting candidates to many specialties. Okay, what specialties can MSRA is going to useful? Okay, I've written here. See, emergency medicine, anesthetics, clinical radiology, community sexual and reproductive health, core surgical training, general practice, nuclear medicine, neurosurgery, obstetrics and gynecology, ophthalmology. These are the specialties which consider MSRA MSRA for taking you into the training, the CT1 or ST1. Okay, this exam is it's a computer-based exam. It has 2 papers. One is professional.
Harish, sorry, Harish. I think Meena will be giving this talk.
Yeah,
actually.
no
She's
problem.
going to detail. Okay. So thank you, Harish, for touching base on the time management aspect of various stations. Okay, I think we have discussed enough on the various parts of the PLAB exam in terms of starting from what is PLAB exam, what are the various stations, what they expect in various stations, what are the various misconceptions around the exam, how to prepare for the exam, and how to manage the time. I think majority of you who are preparing for the PLAB exams would be familiar on most of the things which we had discussed, but you might have doubts here and there, which we are very, very happy to address at any point. If you have any doubts, you can put messages in the chat or raise your hands, or we have the Telegram group where you can put up messages and we can discuss. The next 20 to 30 minutes of our meeting will be on a very important aspect, which has been recently expanded for your further medical training in the UK, which is the MSRA exam. So before I hand over to Meena, so let me give you an overall. What happens is, see, once you clear your PLAB 2 exam, and get your GMC, majority of you will come into the UK and you start doing some jobs, which might be an FY2 job or an SHO job. Ultimately, most of your aims, 99% of candidates who come in will have an aim to further pursue their career in some branches. It could be a surgical branch, or it could be an end specialties like pediatrics, orthopedics, radiology, etc., or it might be physician. So the MSRA exams were have been there for quite some time, but they were used as a component of selecting candidates for a particular, for very few specialities in the UK. But now the MSRA exam clearance or the module has been expanded to include many other specialities, which includes core surgical training as well. So before you enter any of the specialty, or before you reach there, for you to compete to enter in and pick up spot for you, there are certain things which you need to fulfill. One is the MSRA exam. The rest of the things are something like your portfolio building, etc., which I think Meena will give you a talk. So Meena is a trainee from the UK who has finished her medical school from UK, and she at the moment is giving her MSRA exams and looking forward for a career in surgery. Over to you, Meena.
Thank you very much, Dr. Kathavel. Welcome all, and thank you so much for taking the time out of your weekend to come and see this talk. So my talk, as Dr. Kathavel said, is going to be focused on when you're in the UK and you want to apply for specialty. In my case, I'm applying for core surgical training, and I'm currently preparing for this exam. So this this talk will be mainly about orientating people for the examination and just talking about contents and some tips and tricks. Next slide, please. So we want to understand what the MSRA is. We're going to also learn about the contents of the exam, the different practice questions. We're going to cover some examples, and we're also going to talk about preparing and booking for the MSRA. Next slide, please. So here I've just included a list for specialties that require this exam. On the list, one of the newest ones is core surgical training. So this has only been applied this year. It's a very new requirement, and when you look at core surgical training, you start with you have to prepare a good portfolio first. That's like 30% of your application. Then you get invited to do the exam, and you have to score quite high in this exam in order to be shortlisted for an interview. But then when they look at you all together, the interview is where you get most of your points but you need to pass the MSRA to get this interview. So it's very important we know how to prepare for it. Next slide, please. So yeah, just summing up here, 3 main aspects of core surgical training is the portfolio, the MSRA, and the interviews. I'm happy to answer any questions about this at the end, but this talk will be mainly focusing on the MSRA exam. Next slide, please. So what is the MSRA? It stands for the Multi-Specialty Recruitment Assessment. Essentially, it's what you are kind of used to in medical school with your medical school finals. It's that level of knowledge that you need. And it's a computer-based exam. It's about 170 minutes long, and it's 2 components delivered as a single assessment. And we'll talk about those on the next slide, please. So the 2 papers that you will do in this MSRA, the first paper is the professional dilemmas, and the second paper is the clinical problem-solving skills. There's more time for the professional dilemmas because it's quite wordy. You'll be reading a lot of scenarios, a lot of problems, and you're going to have to be ranking problems with that. And then the clinical problem solving is basically a knowledge test. And there'll be a 5-minute break between these papers to kind of give you a little bit of comfort. Of course, under the Equality Act of 2010, if you have any disabilities or extenuating circumstances, you have to apply for these extra minutes. So make sure that you read about that, and I'll give you links for those at the end as well. Next slide, please. So let's first talk about the professional dilemmas paper. And a lot of people might find this challenging because it really comes down to how you read the question and how you would behave in certain situations. So it's a situational judgment test. If anyone's heard about this or done this type of exam, it's essentially looking at what the GMC requires for us doctors to be, professional integrity, our empathy, how we work under pressure, team working skills. So it's kind of like those interpersonal skills as opposed to the knowledge that you pick up when you become a doctor. So it's kind of looking at you as a person, as a human. And it essentially assesses your professionalism in the workplace. So as we said, it's based on 3 core competencies. That's your professional integrity, how we cope with pressure, and our empathy and sensitivity. And in this paper, there's 50 scenarios that you have to answer, and they're kind of split between ranking and multiple choice style. And I really recommend in this exam, you really have to answer every single question. There's no negative marking. Even if you don't get the order quite right, you will still get points. So it's so important to answer every question here. And just follow your gut instinct as well. Thank you. So the clinical problem-solving paper, it's my favorite one because essentially it's just a knowledge test. And it measures your ability not only just to apply your clinical knowledge, but how you would use your knowledge in everyday clinical scenarios in the workplace. As we said, it's foundation level knowledge. So just like the same level of knowledge you get when you finish your finals at the end of medical school. And there are 86 questions here. They are split into extended matching questions and single best answers. And later in this talk, I will show you what these questions will look like. Again, answer every question. There is no negative marking, so just try your best. Next slide, please. So the clinical problem solving paper covers these main 12 topics. I've just listed them here. It's nothing that you don't know already, but yeah, cardiovascular, musculoskeletal, pediatrics, everything that you've basically known in medical school. Okay, next slide, please. And the way you answer these problem-solving questions, it has to target 5 domains. So these questions usually come as, so if it's an investigation format, like a question could be asking you, you know, for asthma, what's like the gold standard way of investigating it, or COPD. For diagnosis, they can give you a patient coming in with a syndrome of symptoms, and you have to kind of guess which is the most appropriate diagnosis for this patient. What do you do in an emergency setting? You have to think, well, what's the key thing you need to do first before anything? And these questions are mainly centered around patient safety. Also prescribing, reading up on your antibiotics. Antibiotics come all the time, as well as other medications and drugs. But yeah, common things are common. Don't go very deep into other like really rare medications that aren't often used in practice. And also management. So managing a patient, think about short-term management, long-term management. We can go into more detail after that, and I'm happy to answer questions as well. But in the interest of time, we can just move on. Next slide, please. So I'm going to go through some examples of questions. So we're going to first go through professional dilemmas. I'm going to read out this question, and if you have a pen and paper, we can rank the answers in order. So this is an example of what scenario you can expect. So
before doing that, Mina, does anyone want to volunteer for this? Because it's just some activities which will be good if someone volunteers and joins. Anyone who wants to join, you can raise your hands. It's just an exercise, nothing to worry much.
And it's really good.
Okay, fine. Let Nishita do that. Yes, you can do that. Yeah.
Fantastic. So Nishita, I'll ask you the question. And just also a side note, all of these clinical scenarios are from the perspective of a foundation doctor, so a very junior doctor. Even if you're more senior than this, it's given from the perspective of a foundation doctor. And, you know, you'll never be asked, like, you're the consultant or you're the registrar, what would you do? They would never ask you that. It's always from the foundation doctor perspective. So, Nishita, you are an F2 doctor working on a medical ward. You're preparing for your consultant's ward round, and this takes place in the afternoon. Andrew, another F2 doctor, is working with you and is also expected on the ward round. He tells you that he must leave the hospital in the afternoon to attend a court hearing about a car parking fine, which he failed to pay, but he does not want the consultant to know about this. He asked you to tell the consultant, Dr. Stevens, that the reason he cannot attend the ward round is because he is unwell. So let's go to the next slide to look at the options we can rank. So the question is set like this: rank in order the following actions in response to the situation. So A, advise Andrew to request leave for the afternoon. B, suggest Andrew informs Dr. Stevens that he is unwell and so can't attend the ward round. C, explain to Andrew that you cannot cover for him on this occasion. And D, inform Dr. Stevens of Andrew's absence, explaining that you do not know the reason why. So take some time, a couple of minutes, and what you need to do is you rank it in order of what you would do first. So first is most appropriate, last is least appropriate.
A, C, D, B.
That's, did you say A, C? What did you say?
A, advise Andrew to request leave for the afternoon.
Yeah, that's a good first choice. And the reason is because you're not put in the position to lie to anyone. You shouldn't be lying, you shouldn't be covering for anyone. And you're putting the responsibility on Andrew to kind of look after his own mishap and mistake. He needs to be confront and be honest. So advise Andrew to request leave for the afternoon. And what's your second option?
Explain to Andrew that you cannot cover for him on this occasion. C.
Yeah, that's also good. So the reason why this is second place is, well, yeah, you can't, it kind of removes the onus on you, but at the same time, you're like, it's not solving the issue that Andrew is leaving. So this is why A is better than C, is like you're telling Andrew this is the best way to go forward, is you requesting leave for the afternoon. Then the next thing is say, well, I can't cover for you on this occasion. What's your next option?
D, inform Dr. Stevens of Andrew's absence, explaining that you do not know the reason why.
Okay, and that's very correct. So the reason why we picked D over B is because withholding information, like not knowing why, I don't know why he's not here, is better than actually lying, which is B. So this is the whole idea of this scenario. So well done, you got this correct. Really impressive. Well done, Nishita.
Thank you.
So do you guys want to do one more of this style, or do you want to move on to the next style? Should we do one more? Okay.
Anyone else who wants to do? Munia, Zaki, you want to do? You look very enthusiastic.
Okay. We'll do
Yeah,
Munya.
why don't you unmute yourself, Muni, and you can do it. Yeah.
Thank you. Yeah, I just wanted to hear what Mina had to say, so I just thought I'd stay quiet for this moment.
No, Munya, thank you very much for joining us. This is quite a good practice as well. So, Munya, you're an F2 doctor working in a hospital. Mr. Ahmed, who is a 62-year-old man, is awaiting the results of tests for bowel cancer. The ward clerk tells you that 7 of his relatives are at his bedside. His eldest son has specifically asked that you do not disclose the diagnosis to Mr. Ahmed if it is cancer, as he feels that his father could not cope. Your consultant calls from the endoscopy suite and advises you that the diagnosis is a sigmoid carcinoma, and this is a very malignant cancer. So he has cancer. You have to break the news, but the patient's son tells you not to tell the patient. So what would you do? Okay, next slide. So here are the options. I'll read them out to you. So A, tell the ward clerk that you will see the son in a side room before speaking to Mr. Ahmed to discuss the reason for this request. B, tell the ward clerk to advise the son that you have to respect Mr. Ahmed's autonomy. Autonomy meaning choice. Okay. C, ask all the relatives to clear the bedside as you need to discuss the findings of the colonoscopy with Mr. Ahmed privately. And D, ask Mr. Ahmed whether he would like his son present when discussing his results. Okay, I'll give you a couple of moments to kind of absorb that because it's a lot of information. So a moment or two, and then we can discuss the answers. Let me know whenever you're ready.
I would say that clearing the room, so number C, is quite, might trigger some relatives to realise a condition might be worse, because why would you clear the room unless you have to actually speak? So that wouldn't be my first option.
Yeah.
I would say that my first option might be A, because the son wants to be informed, but obviously not Mr. Ahmed first. Then I would go to B, D, and C.
Well, almost right. You basically got 50%, well, I'd say 75% of this question right. So excellent. We picked A. The correct answer is A first because, thank you. If we could go back to the options again. So the correct answer is A first because why is the son telling us this? Maybe there's maybe there is an issue. Maybe there's like some context that we don't know about. So it says on your responsibility to explore the reasons why. And as a mark of your empathy, you're a doctor, you have to work as a team with the patients and their family. You don't want to alienate people. You don't want to separate people. So maybe hear the son out and see if there's a good reason. So exploring, being curious, wanting to know more information, that's always that's good medical practice, okay? So A is the first option. The second option would be D. D is ask Mr. Ahmed whether he would like his son present when discussing the results. Like, yeah, it's another way of being curious and seeing if there's any context and without doing anything that might, you know, increase tensions in the group. Then it's B, then it's C. So as you said, Munya, very correct, like asking everyone to clear the room. It's not really ideal. It's kind of maybe a bit dramatic. And the reason why they would kind of put that one last because it disregards the son's request and it shows that you don't really want to work in partnership. So that's why that's like the last option. Okay, so well done. Let's move on. I'll just show you how the other questions look like in the interest of time. You know, I don't, maybe we shouldn't read through them because they do take quite long, but let's go to the next slide. So in this scenario, you'd be asked a question in a similar style to the other questions. And then next question, next slide, please. Next slide. And they would ask you to choose the 3 most appropriate actions to take. So instead of ranking, you look at this list, which is a lot more longer than the other questions, and you pick the 3 most appropriate actions. So, I mean, we can just move on now to the next couple of slides. Just click it, not bit. Yeah, that's another of the 3 most appropriate. I can send this slide to anyone who wants to read. Okay, stop.
Yeah,
So
but the key thing here is, guys, you need to see how these questions are there, and choosing means you need to the important thing is it is not just a single best answer question. So you need to spend time learning, going through word by word. Okay, it's just single words here and there which changes the whole context, and most of the situations you will have one or two options which are quite similar, you know. So that is where your preparation and practice matters, and knowing what is the local guidelines and what's the local practice in the UK matters. Yeah, good, well done, Mena, go ahead.
So thank you so much. So now let's look at the second paper. So we looked at the first paper, the problem dilemmas. Now we're looking at the clinical problem solving. And this might be more up everyone's alley because it's a bit more straightforward. It's less, I guess, less deciding between one and the other. There's never a correct or right answer. But here, at least there is a correct answer and you can hit it on the dot with enough studying, of course. So this is called the extended matching questions. And they would give you like a list of diagnoses or a list of investigations and whatnot, and they'd ask you a question. So select one option from the list above. Each option may be selected more than once, like once, more than once, or not at all. So you can reuse any option from this list as much as you want or not. And they'd ask you two questions. So the first question is, let's look at this one. A 58-year-old woman develops a tremor and has repeated episodes of breathlessness associated with tachycardia, fast heart rate. So looking at this list, does anybody want to tell me the answer for that? Anyone at all? This question is
Yeah, who wants to answer? Sibi, you want to try?
It's C.
Yes, correct. Hypothyroidism. Well done. And so and then the next question would also kind of, it would ask you similar questions. So a 44-year-old woman develops tingling in her fingers 3 days after a total thyroidectomy for a papillary carcinoma of the thyroid. And the same way, you would have to pick one from the list, and that's
Hypoparathyroidism.
Correct. Well done. Well, you're definitely going to do well in this exam, Sibi. Well done. Okay, let's go to the next slide. Okay, so this is an example of a single best answer for the clinical problem solving paper. And this is one of my favorites because you just you get the question and then you select the single most likely answer from the list. So yeah, let's read it. 17-year-old student suddenly develops chest pain and dyspnea, which is shortness of breath after a morning swim. His trachea is deviated to the left and there is hyperresonance with decreased breath sounds on that side. Okay, what is the single most likely diagnosis from the list below? Select one option only. So can anybody give me an answer?
Pneumothorax.
Correct, pneumothorax. And then you just move on to the next question. So you do about I think there's like 80 questions of this. Anyway, let's discuss some advice and tips. This is not the easiest exam, and it might not be the most difficult exam, but it's really important for us to prepare early, make a plan, allocate as much time as possible. We, as doctors, we live very busy lives, and we want to be able to also move and progress in our careers. And in order to do that, we have to be organized with our time. So allocate as much time as possible, 1 hour, 2 hours a day, however much time you have. And don't be last minute, don't cram. It's never a good idea. And there's a variety of different question banks and resources you can use. I've included a slide later, which I will show you. Again, no negative marking, answer every single question. Reading the question carefully, very important, especially for the dilemmas. And make sure to look at it from every angle. Look at it from every angle. Try when you're practicing, when it's closer to the exam day, try and do it in a mock style, which is put on a timer and see if you can answer all questions within the time limit given. There's a lot of words to read. I know if you're coming also into the UK, the language might be different. It might be a bit difficult for some of us. So I want to also let you guys know that in these exams, there's always a list of abbreviations that you can look at. They usually add that at the end of the paper, or they'll give it to you as separately. I think if you can request for that as well, for like some common medical terms that we use in the UK that doesn't get used anywhere else. But yeah, just also, I think, try and familiarize yourself with those list of abbreviations as well before you do the exam. And it's on the NHS website, which I've linked at the end. Again, study with friends, the more the merrier. It makes it a bit much more fun and much more enjoyable. Yeah, next slide, please. So here are the question banks. There's actually even more than this now. I personally use past medicine and past tests. I always feel like that they're more accurate to what we see in real life. Next slide, please. And I won't go into too much detail, but this essentially is a slide of how to prepare and book for the MSRA. So once you've submitted your application for your specialty, in our case would be core surgical training, you'll be sent a link via Oriel, which is the online platform where you send your application. You'll be sent a link to register. You have to make a Pearson account, and this has to match the credentials of your Oriel account. And once you're registered and you get longlisted to be invited to do this exam, you can book whichever center you want, whether it's close to you or far from you. Try and book as early as you can, because these slots do run out and you want to be able to get a date in ASAP and start preparing for that date. The reason why it's a Pearson account, because it's the companies and the venues called Pearson. That's where the computers are. You can't really do it from home unless you have a reason to, like you've got childcare, kids, disability issues. Then yeah, you can request to do it at home, but for most of us, you have to do it in a venue there. And pretty much that's it. That's all there is to it. And all I can say is just to, wish everyone the best of luck when it comes to this. And I'm really happy to answer any questions. And these are finally my resources. And final slide, please. Yep. I like this picture because this is what I feel like all the time. Any questions, I'm happy to answer. And I'll also leave my email here on the chat if anyone wants to email me any questions. So thank you very much.
Thank you very much, Meena, for this brief and a crisp session on the MSRA exams. Any questions, guys, among the participants? Yes, Arun Gaur, could you please tell how to secure? Okay, just let me put okay. Could you please tell how to secure attachment in London? Did you call up the trust or just an email, or did you physically visited the trust? Okay, so what you need to do is you need to email one of the consultants, whoever you know. Okay, most of these contacts you will get from your friends or forums and stuff. You need to email a consultant telling that you are interested in joining as a clinical attachment person in that particular trust. And each trust has different policies. Some trusts, many of the trusts is just free. Some trusts collect some fee for that. And it is predominantly a consultant-driven process rather than you visiting a trust or anyone. You need to speak to a consultant. And if you have any permits, I'm much happier to help. I can put up my email ID in the Telegram group, and you can email me and let me see how I could help. That's how the attachment is obtained. Any other questions, guys, from anyone? Is there any resource for FY2 standalone SJT? Any idea, Meena?
Yeah, so there is a practice paper for the standalone SJT.
Mm-hmm.
If you send me an email, I can send it to you.
I think I want to intervene. I think, I'm not sure, but what I've read recently is UKFP in Oriel for 2024. I think they are thinking about removing SJT as a criteria. So I'm not sure if SJT is going to be a part of UKFP application in Oriel from next year. So make sure you follow up what are the guidelines for UKFP application. I think you will have the application opening in about January 2nd to 3rd week in Oriel. Make an account and keep before that. And there are some criterias you need to have when you're applying for UKFP. And I am not entirely sure if SJT is part of it, because I've read through various articles that they are not planning to include SJT as a part of UKFP criteria for the coming year. So open an Oriel account and follow up in your Oriel account for UKFP criteria in about January 1st to 3rd week. Yeah, that would be my advice.
Why don't you, Sibi, put those links and details in our Telegram group so people can get in touch with you if they have a need? Yeah, just put us a rough brief of what they need to do and what they are looking for. Similarly, Meena, if you can put some valuable resources now and then, and whenever some update comes, or whichever you feel interesting or which is quite essential for the candidates, if you can put up in the Telegram group, that will be good.
Yeah, of course. Yeah.
Good. Thank you. Thank you. In Uzbekistan, we don't have a Pearson View Test Center. Can we request for home exam MSRA? I really don't know if MSRA exam happens in any other country. Does it happen, Meena?
I believe it does happen in some countries.
Okay.
I'm not sure what's the situation like in Uzbekistan.
Yeah.
But maybe just check if you can get on the customer service to check if there's an equivalent to Pearson Center in Uzbekistan. If not, you have all the eligibility to request for a home exam.
Yeah.
So, yeah.
And again, you can go to Oriel, for applications. Like you can go to the previous year application and go to view centers. You will get a list of centers, through your link from Oriel, which in all countries have view centers, and where and all it is specifically there for you to, get it.
Yeah. Thank you, Sibi. I think Salman has told something about the recent update. It's only applicable for FY to standalone. Good. Right. Any other questions, guys? Any other questions? So I think you would have had some information about the MSRA exams and the PLAB exams. We really don't know what is your level of training and what are you looking for here. But our aim is just to create and give a platform where you can learn and get guided for the PLAB and the MSRA exam. From next weekend onwards, we will be having individual modules, which is predominantly an one-to-one interactive session rather than just lectures, where now we will be putting those announcements in the groups, and it's again free. You can just come in, and exactly like how we did some practice questions, from next week onwards, it will all be practice sessions where you will be given a real-time exam scenario. You will participate, and the examiners will give you some feedback. It is just to make you oriented towards different stations and stuff. So that's what we are planning to do. But again, we are much happy to help and guide in any other aspect, starting from your clinical attachments, getting jobs in UK. When I say getting jobs in UK, we are happy to help you in finding where to look for jobs, what is expected in the interviews, how to crack on the interviews. Those things we can absolutely help you and guide you, because most of the candidates here are doing that processes, and I'm pretty sure they'll be much open to help you all. Yeah. So if there is no further questions, I once again thank all the speakers today and all the participants today. Thank you very much. And if you have missed this session, or if you think that this session would be useful for someone else, we will be uploading the entire video in the YouTube, and we will be sharing in the group as well. And please do share with your friends about the upcoming sessions, and you can join as groups or individuals and practice on the weekends. Yeah. I have one more question which has come. If I have MRCS, should I still sit MSRA? Yeah, so I think probably I can answer this question. So if you have MRCS and if you want to join an ST3 program, I don't think you need MSRA. Yeah. But what if someone has MRCS and still they want to do a core surgical training?
So, sir, MRCS doesn't actually really matter in your core surgical
Exactly.
application. So,
Absolutely.
the one criteria which is very important in core surgical training application is you shouldn't have more than 18 months of surgical experience post foundation year experience. So,
Exactly.
if you don't have that, you're eligible to apply for CST even if you've completed MRCS Part A, Part B. That doesn't matter.
No,
So,
the question is, even if he has MRCS Part A and Part B, if the candidate wants to join a core surgical training, he needs to give MSRA exam. Yeah.
yes, he
Correct.
does.
Yeah.
Yeah.
That's a answer. Yeah.
I feel like if you're joining the ST window, then the MRCS is what's
Yeah.
needed.
Yeah.
But if you're doing
Absolutely.
CST, you need the MSRA.
Exactly. Yes, and another thing which Sibi mentioned is many candidates, they don't know this fact. Yeah, so you come into UK, you will join a surgical unit. By the time you realize to apply for the CST and stuff, you would have finished a year, which is almost 12 months of your experience in general surgery. But as Sibi mentioned, even if you had worked in any of the surgical unit in whatever position you were, if you had worked more than 18 months, you won't be eligible to join a CST program, but instead you can only join as an ST3, which is quite competitive, less seats, and I would say if you're an untrained surgeon, it is not a good pathway as well. That's what I would say.
Yes, that's correct.
Good. I think we have run the session for 2 hours, and I think it was a very good beginning for a series of webinars which we are going to have. And thank you all for participating in today's webinar. Thank you very much, and we will catch up next week. Thanks.
Thank you, everyone.
Bye.
Thank you. Bye.
Thank you.
Bye.
All of you have a great day. Goodbye.
Thank you.